Hi guys, my name is Jose Austin. I'm a John Ed from the batch of 2008. And the purpose of me making this video is to explain to some of you or help understand what is a clinical audit and how this is something which you guys can do when you're in India and don't really have to wait till you come to UK. And I'm going to be using my own example of an audit which I did in India. And if you're able to evidence this properly, then this is something which will definitely add to your portfolio or your CV. Before I move on to the audit which I did, I'd like to start by explaining what is the difference between a research versus a clinical audit. So, a research is in a research, we're looking at gathering new data or new evidence in an area of interest, whereas in a clinical audit, the standards or guidelines based on the current best evidence is already there, and we are trying to look at how our practice compares against these standards or guidelines. If I had to use DVT prophylaxis as an example, we have oral anticoagulants such as apixaban or rivaroxaban. And if you're asking the question, as compared to apixaban, whether rivaroxaban is better or not, then that constitutes a research. We're looking at new evidence which is based on hypothesis, and this may involve randomization, allocating to various patient groups. Whereas when it comes to a clinical audit, using the same example of DVT prophylaxis, there's already there are established standards or guidelines for post-operative DVT prophylaxis, such as patients receiving injectable heparin post hip surgery or knee arthroplasty. But whether they're actually receiving it or what is the reason behind that not happening. So, that is what we look at in a clinical audit. There is no randomization, no allocation. So, research looks at new evidence based on hypothesis. Clinical audit is basically gathering data against established standards or guidelines. So the audit comprises of an audit cycle, and the first step of this is to be able to identify a problem or an issue. We talked about DVT prophylaxis. Another example could be effective hand washing happening in the wards or before and after seeing a patient. If you're looking at maybe sodium monitoring in head injury patients, or whether the operative procedure notes are as per standard criteria or guidelines. So we identify a problem or an issue. Then we look at what are the standard guidelines which are which are there as compared to the present evidence. And then we start collecting data and then compare that against those standards which are there. Then we're able to identify certain deficiencies in practice or at times good areas of good practice. And then we present this data at a department or a local or a hospital meeting. This is then followed by recommendations, and if there are any changes which are recommended, then we try and implement those changes, and then we go back and try and collect the data again and see whether we have brought about an improvement in practice. So that constitutes an audit cycle, and that sort of closes the loop, and that's what is referred to as a closed looped audit. And multiple times when we keep repeating this cycle, and if it improves the quality of care of patients, then that sort of in some ways constitutes what we refer to as a quality improvement project. It's important to realize that an audit is not an exercise to criticize, but one needs to look at it more as a form of reflective and introspective practice. So now coming back to the audit which we had done when I was in India, it was basically to look at the completeness and quality of the operative procedure notes which we had in our department at the institution that I was working. So, what is the standard or guideline that we audited against? The Royal College of Surgeons, in their manual titled Good Surgical Practice, has earmarked certain criteria which constitutes, or rather, what a good operative procedure note should have. Even though we had a detailed operative procedure template in JIPMA, but whether we were actually complying to those standards is a question we asked, and is what we wanted to look at. So we looked at 30 operative procedure notes, and we collected this data retrospectively. This is again a difference between an audit and a research. Sometimes research can go on for months and years, whereas an audit is something which we can do in probably a week or 2 weeks. Doesn't need to have a big sample size. You can look at maybe 20 to 30 cases, and that's what we did. Then you will have certain inclusion exclusion criteria. Then based on that, you look at you get certain results, and these results are then subsequently presented in a department meeting or an audit meeting. And then you identified certain areas of good practice, certain risks, and areas where there can be improvements. Then certain recommendations are made. So, with regard to our audit as well, we found out how we could, what was lacking in our documentation of uh, in the OT notes. What are the aspects that some of us were frequently forgetting? Then what we decided to do was, based on the recommendations, we made a poster and then put it up in those areas, especially in the post-op recovery, where some of the residents, or most of the residents, were writing their OT notes. And then we went back after a month and collected the data again to see whether there had been any improvement, and in this particular case there was. So that was, again, we closed the loop on an audit, uh, on a previous audit which we had done. So that sort of completed the audit cycle. So um, so after the sort of department presentation, what you need to do is to be able to write a clinical audit report, and then also get a certificate from your head of department stating that you were involved in the audit process in various capacities, such as data collection, data analysis, presentation, and writing up of the audit report, which is how you're going to sort of correctly evidence your work when you do a clinical audit